Words can't explain how much I love having my patients complete the Masako maneuver just because of how effective it is for overall swallowing improvement. But I'm going to explain what the Masako maneuver is and just how beneficial this exercise can be. So let's talk about it. Now, for privacy reasons, I have only displayed the portion of the neck, but these videos I'm going to show are a really nice collage of what a Masako maneuver actually looks like. Now, the Masako maneuver, also known as a tongue hold maneuver, is a compensatory and therapeutic swallowing technique that's used primarily to improve pharyngeal strength and contact between the base of the tongue and the posterior pharyngeal wall during swallowing. Now, to understand all of this, you definitely need to understand what takes place, like what's the actual mechanism during a normal swallow. So, during a normal swallow, the tongue base retracts to make contact with that posterior pharyngeal wall, and this helps to generate pressure that's needed to propel the tail of the bolus through the pharynx or through the throat area. In patients with reduced tongue base retraction, this contact is weakened, and this can lead to residue and increased risk of aspiration. Now, in the Masako maneuver, the patient holds the anterior portion of their tongue, about 1/4, between their teeth or lips, and then swallows without letting go of the tongue. I want you to think about what's happening here, because this movement restricts the tongue's ability to retract, to propel backwards. Therefore, this forces those throat muscles, the pharyngeal constrictors, to compensate by moving more vigorously to complete that swallow. So now what actually happens when you continuously do this Masako maneuver? It helps to increase that posterior pharyngeal wall bulging. Essentially, you're strengthening those muscles over time, and you're going to improve that overall pharyngeal pressure while you're swallowing. Now, as if the Masako maneuver wasn't a superhero all on its own, imagine what happens when you pair this particular exercise with some resistance from neuromuscular electrical stimulation. So we already know that the Masako maneuver, it isolates and it stresses that posterior pharyngeal wall by limiting tongue-based retraction. Now, when you pair that with NMES via AmpCare's effective swallow protocol specifically, it enhances neuromuscular recruitment, and this allows for more targeted and intense muscle activation, greater cortical reorganization and neuroplasticity, and faster and more sustained strength gains. So what does all of that mean? It means that you will be strengthening those throat muscles faster and stronger than you would all on your own. So when people say have a speedy recovery, this is exactly what we're talking about here. Now, while the Masako maneuver can be effective in targeting pharyngeal wall movement and strengthening, it's not always appropriate for every single patient. So, according to ASHA, the American Speech Language and Hearing Association, which is the governing board for SLPs and audiologists, some contraindications include patients with limited hyoid displacement or reduced hyolaryngeal elevation. These patients may rely more heavily on tongue base and suprahyoid coordination to achieve airway protection. And so when you restrict the tongue base movement, as what takes place when you do the Masako maneuver, this can further impair their swallow safety. So again, there's a lot of clinical judgment that's going to be taking place when you have a patient complete these exercises. The second contraindication that they listed is for a patient who already has weak pharyngeal constriction. The Masako maneuver may overload those compromised muscles. Now, aside from those contraindications, some precautions to keep in mind would be for patients who have a cognitive impairment or an inability to follow directions. So this might make the exercise essentially ineffective, or the patient might not be able to complete it. And lastly, I have noticed that when a patient completes this exercise, it does cause some muscle fatigue. So I typically like to leave it for last or at the very beginning. I also want to bring to your attention that this exercise cannot be completed with food or liquid because as the tongue is restricted, it does hinder the normal swallow mechanism, and this can definitely pose a risk for aspiration. Now, when it comes to dysphagia, you may notice some symptoms like coughing, drooling, pain, discomfort, or even food residue, but I would advise against self diagnosing and simply following exercises that you find online. I would recommend that you seek professional advice, and if a swallowing impairment is suspected, then more than likely your physician would refer you to a speech language pathologist for an evaluation. Again, it's also really important just to work with a speech language pathologist for complete safety and efficiency of the exercise. All right, that's it for this video, guys. Thank you so much for spending the time with me to learn about the Masako Maneuver. If you found this video helpful and you're interested in more adult speech pathology related topics, go ahead and like this video and subscribe to my YouTube channel. I truly enjoy my line of work, staying up to date with clinical research and creating these types of videos. I'm really nerdy, so your support goes a long way to know that you're also interested in these topics. So yeah, go ahead and subscribe to my YouTube channel. Thanks again, guys, and I will see you in the next video.